This episode is not brought to you by Gatorade. Yeah, we're not sponsored by Gatorade, but we are going to talk about the Decubitus ulcers in this episode, aka bedsores. So, Decubitus ulcer, aka bedsores. It's when there's too much pressure on a certain point of the skin for too long. It obviously happens mostly on pressure points. So, like, say the butt or parts of the back when people are laying down, not moving often. Too much pressure, it starts to almost. So there's going to be a lack of blood flow. Say if this is the bottom of my buttocks, going to be pressure, not enough blood flow, and it's eventually going to kind of tunnel in and start to create an indentation or a hole into the skin there, and that obviously increases risk of infection, and it is a positive feedback, so it does get worse and worse as you move it less. It's going to continue to get worse. So the best way to help these decubitus ulcers from forming, if you're in the nurse, if you're a nurse, if you're an aide, if you're caring for anybody, is don't let anybody lay in one position for too long. So after about 2 hours at the maximum, rotate somebody so they aren't putting a constant pressure on a certain part of their body, and just be aware of those pressure points as well too. As decubitus ulcers, they they're not a good thing. They do increase that risk of infection, and obviously, as somebody's health is getting worse and worse, the decubitus ulcers will get worse and worse if they aren't cared for properly, because they aren't going to have aren't going to really recognize that they should move their bodies and things of that sort. So there's multiple risk factors of decubitus ulcers. Obviously, old age, dementia, darker skin because you can't see these tunnels into the skin, uh, compromised sensation. So if you can't feel it, it's obviously the decubitus ulcer. You can't see it, it's going to continue to progress. Yeah, there's a few other things, but that compromised sensation, lack of mobility is obviously a big one there, and there's a few others. But think of a decubitus ulcer as think of as somebody sits on a couch for too long. The couch eventually there's eventually an indentation into the cushion. So in this analogy, the person sitting would actually be the pressure. So it would almost be reversed. Person sitting on the couch would be the pressure, and then the indentation in the couch would be the decubitus ulcer. So think of somebody lying on a bed. This is the part that's pressuring on the bed. There is where the decubitus ulcer is going to form. It's where there's gonna kind of tunnel into the skin. So there's 4 stages of decubitus ulcers. First stage, the sore is closed, so it hasn't broken the skin yet. So there's not, an increased risk of infection yet. There's just a lot of redness, which is also called erythema. So we've seen this with erythrocytes, red blood cells. Ery means red, so redness, erythema. Second stage of decubitus ulcer, it progresses from that first stage, gets worse. It's called partial thickness condition. So the sore is open. It's an open sore now, which increases the risk of infection because it's open to the exposed to the environment. Bacteria can grow, fungus can grow, all that not good stuff. So there is damage through the epidermis with a partial thickness condition, the second stage. If it doesn't heal, progresses worse. So if you don't heal that second stage, it's going to go to that third stage called full thickness skin loss. So full thickness skin loss, there's damage to the epidermis and the dermis. It can actually go all the way down to the hypodermis there. So it gets pretty deep. Full thickness skin loss, and obviously risk of infection increases here as well. And then fortunately, there is a fourth stage. If stage 3 doesn't progress, this is called damage. Well, it's not really called anything, just stage 4. It's damage to the epidermis, dermis, and the hypodermis, and it might actually extend all the way down to the bone. So it can be pretty nasty stuff, and obviously the increase or the risk of infection continues to increase as the stages increase as well. So stage 1, sore is closed. Stage 2, partial thickness, open sore, damage through the epidermis. Stage 3, full thickness, skin loss, damage to the epidermis and the dermis may extend all the way to the hypodermis. And then stage 4, damage to the epidermis, dermis, hypodermis may get all the way down to bone there. So if you're caring for patients, just a reminder, Move them every so often, every 2 hours at the very most. Ideally, a little less than that, and just be aware of those pressure points, because the pressure points is where the decubitus ulcers form. So once they start to form, they will get continuously progress and get worse if an action isn't taken to alleviate these decubitus ulcers. So if you start to see stage 1 form, really be vigilant, really be aware, and make sure your patient does not continue to put pressure on a certain area. It's just going to continue to tunnel in and dig and increase that risk of infection there. But that's decubitus ulcers, aka bed sores. Not pretty stuff, but they are they can be managed with whenever the caretaker is aware of these pressure points, and also moving the patient. But yeah, just be aware of that, and those are the 4 stages of decubitus ulcers.